Hello, welcome to the Dear Encourager podcast, where real stories meet radical hope. Hosted by Vanessa Scott and Keisha Nix. This space is made for anyone navigating the journey of chronic illness and caretakers seeking connection, compassion, and a community that gets it. Each episode, we bring you conversations that uplift, strategies that empower, and encouragement you can carry with you throughout everyday life. Let's grow stronger and healthier together.
Hi, everyone. Thank you for joining us tonight. I'm Keisha.
Hi, I'm Vanessa, and tonight we have the pleasure of having Dr. LaTashia Kiel. She's a family nurse practitioner for the last 3 years. She's been a nurse for the last 17 years. She's an entrepreneur, a health coach, caregiver, and the co-leader of Luke's Church Health Awareness Ministry. She's passionate about prevention and she does everything to help people take care of their health. She's an expertise on the field of athletes, track, trauma nurse, and she's a professor at University of Texas at Austin in the School of Nursing. She's a cardiology nurse practitioner, a mother, a sister, your homegirl, your friend, and she started her entrepreneur business, Heart and Soul Health, to continue the work of prevention in the lines of weight loss, high blood pressure, pre-diabetes, diabetes management. So today, thank you so much, Dr. LaTashia, for joining us.
Yes,
Yes, no,
thank
thank you
you.
guys for having me.
Ooh, that was a great bio, and we definitely need more people like you for people of color because we definitely know that high blood pressure and diabetes are very prominent in our culture. What
Mhm.
are some things that can help us manage this? What are some things that make us more prone to these diseases as well?
So high blood pressure is one of the most prevalent diseases in the world. And so I think the last time I looked at the numbers, half of the people in the world have high blood pressure. And that means like literally it's three of us on this podcast right now. One of us probably have high blood pressure and one of us on the way, right? Um, and then of the people who do have high blood pressure, only 1/3 of those people actually have high blood pressure that's managed well. And so typically what we've believed for the longest time is that it was because of the salt in our diets, right? So we do know that water likes to follow salt. And so anytime you have a abundance of salt in your diet, you guys know we like to season our food. Water follows it. And then anytime you have the salt, the water is following it, it just makes it to where there's more volume inside of your body. You increase the volume. Anytime you increase volume, automatically increases pressure. One of the things that I noticed in my research here in the last few years, working in cardiology, was that we've always believed that the salt in the diet was what was causing people to have high blood pressure. There's a lot of research now that is showing that it may be more so linked to insulin resistance than it is to the amount of salt that we're consuming. And so I'm really kind of interested in seeing kind of how that science is going to evolve over the next several years. Do we know that salt will raise your blood pressure? Absolutely. However, it's usually a initial spike and it'll stay elevated for a period of time. It's not something that's consistent. So again, I'm really interested in knowing where the science is going to point us once we kind of tease out this insulin resistance to see what kind of role, how big of a role it's playing in people having elevations in their blood pressure.
That's
Wow,
an
that's
interesting fact and point when we know,
yeah.
because I know my mother had high blood pressure and she also was diabetic. So, with those two going hand in hand, it would be very interesting to see how many people have high blood pressure and have diabetes
And
with
you
it
know
being
the
insulin
thing,
resistant.
yeah, the thing about diabetes that's very interesting to me that again recently just kind of researching things in the spirit of wanting to take better care of our people, I realized that we don't do a very good job of testing people for pre-diabetes. A lot of times we are doing like routine labs. People are checked with the hemoglobin A1C. That is a test for people who have diabetes. The only thing that test is telling us is if you have diabetes, how well has your diabetes been controlled over the last 3 months? When I talk about being passionate about prevention, this is what I'm talking about. The test that we should be running is an oral glucose tolerance test. We don't do that. We don't do it because it's not convenient. It's a test where you go in, you drink some type of elixir they give you, and then 2 hours later, they'll check and see where your sugar level is at that time.
So it's like the one that they give us when we're pregnant.
It's exactly like that, Tiff. Yeah, 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 yeah.
Oh, okay.
Yeah. And the thing is, the difference between those two tests is one tells you your current state of your body's ability to handle blood sugar. The other one, again, is only telling us if you do have diabetes, how well has your diabetes been controlled over the last 3 months? And the thing is, if we are only checking a hemoglobin A1C, oftentimes when it gets to the point where we are diagnosing people, we've missed the mark. And so people can be walking around with insulin resistance and not knowing that headed straight for diabetes. Their hemoglobin A1C is normal. And so we've had a massive window of opportunity that was just missed. We could be treating people for pre-diabetes in an effort to avoid diabetes, in an effort to get their blood pressures better controlled.
What you mentioned in that for myself, when I would go to the doctor, like if I wanted to get this test done, how would I request it? How would I go about doing that? And would my doctor give me the test to test me?
That is very, very great question. I come across this oftentimes when I start to talk to patients about it, where they go, well, I went back to the doctor and they wouldn't order the test. A lot of times it's because they don't know. And so when you want to talk about advocating for yourself, right? So this is what I heard. This is what I read. I printed this out so you can read it. This is the test that I want ordered. And this is the reason why. Again, this is unfortunate. Our healthcare system is not set up for health care. It is reactionary care that is based on now that we know what the problem is, we can start writing prescriptions, ordering tests, and sometimes here's the surgery that you need. But it doesn't allow us time to really get in there and practice prevention. And so I would go out on a limb and say a lot of physicians, nurse practitioners, physicians assistants don't know that this is a better test. And so it's not because they're not wanting it to provide excellent care, it's because they just simply don't know.
Do you have the name of the article that, we can share with our listeners so we can get the word out? It'd be like, because in this article right here,
Huh.
this is what
I can share that information with you guys.
that would be
Absolutely.
great because if we can start the education of the medical community, that
Hmm.
would be great because then they can start sharing it with their family members and we could begin, the education of the community. And they can take this and be like, hey, doc, nurse practitioner, all of that. This is something that I've read, and this is
Hmm.
why I want this test. And I think that would be a great way for us to help our listeners be able to advocate for themselves and for
Okay.
ourselves.
Exactly. And I think that's very important what you're saying is that the lack of education because we know I know from time I was, I don't know, 6, 7, don't put too much salt because you're going to cause yourself to have high blood pressure. So when you saying the new information that you discovered, how important is our nutrition? What we are intaking since it is whether it's salt or if it's insulin resistance, how much does our diet play a role in this and how can we manage it and what can we do?
Yeah, so diet is plays a huge role in managing our blood pressure. And so a lot of times, I used to run this weight loss clinic at the this cardiology practice that I worked at for many years. And one of the first things people used to say when I try to say, "Hey, you need to come like join our weight loss program," they say, "Well, I know what you're going to tell me. You're just going to get me in there and tell me all the stuff I can't eat." And I'm like, give me an example. Well, I love eating chocolate cake. And so I don't want to come in here for you to tell me I can't eat chocolate cake. I go, well, you came to the right place because I'm not going to tell you not to eat the chocolate cake. So they're like, what do you mean? So my thing is being mindful about what you choose to eat. We all know what the right thing to eat is, right? They've nailed it and drilled it into our heads since we were born. Fruits, vegetables, you want to stay away from the fried foods and things of that nature, a lot of sugary things. And it's hard, right? Because the way our society is set up is not to stay away from those things. Don't think for one second that the food industry is not doing everything they can to keep you buying the food that tastes good to you. And so there are addictive substances that are put in the food to literally make you addicted to things. So we have to be mindful about the things that we consume. I tell my patients all the time, I'm not going to tell you not to eat the chocolate cake. What I will tell you is how much chocolate cake are you eating? If you're eating a whole chocolate cake every day, what I would ask you is for the next week, can we eat like half of the chocolate cake instead of the whole chocolate cake? Okay. So we got past the week and we were able to do that. So can we now eat a half of that half that you were eating? And you get to the point where you realize that you didn't really need to eat the whole piece of the whole chocolate cake, you know? And it's the little changes that make a huge difference over time. Again, we continue to try and make sure that we are getting the fruits, the veggies in, making sure that we're eating the correct amount of meat. I think we tend to overdo it sometimes. The serving size for a piece of meat is your palm. And again, trying to make slow, subtle changes because those are the types of things that are sustainable. A lot of times these people are jumping on fad diets, they are starving themselves, they're doing all these really extreme things. And long term, they're just not sustainable.
Well, when you mention that, especially with a lot of things now, it's protein, 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 protein. So when you thinking, and I know even for myself, and it's because I think when you said the meat is supposed to be the palm of my hand, and I'm like, when I look at the amount of protein that's in meat, that you thinking it's just like, oh, I got to eat the whole cow to get enough protein for the day, and it's just like, so what are other substitutes, because I know protein is very, especially when we're talking about when we're getting up in age, for our muscles,
Mhm.
collagen, all of that. How do we supplement when we don't need to eat, the
Mhm.
whole cow to get
Right.
enough protein?
You just want to. So what I would suggest is literally to get on Google. This is the one time that I would tell you Google is your friend. So to look to see what types of alternatives they have. Right, where are other places that you can get some really good sources of protein? And so I know Greek yogurt is one that's thrown out there quite a bit. I think sometimes people get confused on how much protein is in like boiled eggs, for example. Nuts. These are all. Uh, Sources that have protein, but you want to kind of look across the board to get just have some variations in what it is that you're eating. But then that can give you some really good options of other things you can alternate.
Thank you, because I know that's one thing that I myself struggle
Struggle
with.
with the protein.
Well, yes, and the yogurt is one of the things that I do because they do have, it's called ratio, and I'm not putting that out there for anybody, but that's the one I get because it has 20 to 25 grams of
Hmm.
protein in it, and I'm just like, put a little granola in there, and there's my breakfast, and I've gotten 25 grams of protein.
Yeah.
But I do know, like, before, I didn't realize when I thought I was getting a lot of protein, I wasn't, because it's not as much in a piece of chicken as you think. It's like, you know, 12 grams. Like, oh, dang, I need to eat five more.
Yeah.
Love when Vanessa comes to visit me because I'll be like, let's go get something to eat. And she's like, yeah. And I'll be like, well, let's go here. And she says, how about we go to the grocery store? and we go get blah blah blah, and we can make the salad, and we can do this,
Hmm.
and I'd be like, yeah, yeah, we can do that. That does sound better. But I have a question, and I should know that. No, I don't. I should know nothing. Eggs. Okay, you mentioned boiled eggs. Now, I always be like, an egg is an egg is an egg. But apparently,
Hmm.
so the boiled egg versus the scrambled egg, and what's the difference?
I don't know that there really is a difference. I have not read anything that points out that there's a difference in the way you prepare the egg. I do know that eggs don't tend to have as much protein as we think is in them. And the other thing is there was a big, huge issue with like eggs and cholesterol for a point there where people were just like, if you eat the yolk on the egg, is all this cholesterol. It does have cholesterol in it, but again, there's been a lot of research that shows that eating the boiled egg and the yolk in the egg doesn't worsen your cholesterol any worse than anyone eating anything else. In terms of the question that you're asking, I don't know that it matters how you prepare the egg.
I'm just gonna throw this out there, probably because we're gonna cook it in some butter.
Now you add
My
extra
scrambled
butter
eggs
to
are
it.
not.
Yeah, my
It's gonna be
scrambled
buttered up,
egg
okay?
is.
I'm telling you right now, my scrambled eggs they finna have lots of butter in it because I gotta have some flavor. So that's probably.
My
I'm just gonna
goodness.
put that out there. That's
Okay,
probably
well,
why.
now
So that
that
may
is
be
true.
where
My
the
my
other things are coming
style
from.
will be not
Yeah,
bland.
you know the boiled egg. We just gonna throw it in some water. It ain't changing. But that scramble, we finna some oil or some butter. It's going
Something
in.
in there.
That's true.
Yeah.
That's
Um, so since we're talking about diet, we know that's very important. Let's go on the other side of the coin.
Hmm.
You know, that exercise, like,
that's
and
not
get
that's
how
not
first,
Dr. Latasha's
first
problem.
how important it is, and then the second thing is give us a few things that we can do that are not too intrusive into someone's daily life that hasn't exercised in a couple of years or whatever, where they can start.
Okay. So exercise again, very, very important. Again, I'm always kind of going back to the things that I find myself continuing to say over and over and over again. What I've known, what I've come to know in my experience is I can tell the difference between people who exercise and people who do not very easily. And this is as people age, right? There is a stark difference between being alive and living. Okay. And the decisions that you make today are you are putting money in a bank, and it's either the being alive bank or the living bank. And you get to make that decision. When it comes to moving your body, I'm always telling people you get to decide. Once you're 80 years old, are you just alive? I'm here. Or do you want to be an 80-year-old that's living? And I mean living their best life. And so you have to move your body. You have to. It is the I guess if you want to call it the glue that holds everything together. Is everything. The recommendation for exercise is 30 minutes, or it's 150 minutes per week. So if you average that out, that's about 30 minutes 5 days a week. And so some type of way you got to find a way to incorporate it. It's one of those things that it just got to happen, right? You have to get some sleep. It just got to happen. You need to exercise. You need to move your body. It just has to happen. I usually try to tell people because life happens, right? And you get busy. There's so many things
Yes.
going on. It's like, how do you incorporate exercise into all the busyness that you have going on? You just got to find a way. I'll give you a prime example. So this past week, my daughter was out for fall break, which is this new phenomenon, right? Where you're there out for a whole week, and I'm like, girl, what we gonna do? And so normally what I do is I drop the girls off for school in the morning. And after I drop them off, I come home, I exercise, take a shower, get my day started, and get to work. Well, now she's here with me, and I'm just like, well, I can't just like go out and exercise. And it's just I started a new business. I've been kind of weird about passing my business cards out because it just is not natural, right? So I'm trying to put the word out there. Hey, I'm here. If you guys need help, like I'm here to offer my services. I'm going to walk in my neighborhood and I'm going to pass out business cards, right? Put them in people's doors, right? So what I've done is I've knocked out like five birds with one stone, right? So I'm walking, so I'm getting my exercise in for the day, promoting my business, so I'm passing the cards out. Hired my daughter. I paid her $5, y'all. She was so happy. Hired my daughter to be on the marketing team for my business, and got to have some really awesome conversations with her about, again, business and this is your first job. What kind of questions should you be asking? This is incorporating everything that I need to do and just getting it done. I use this same type of attitude when I'm talking to my patients. You got to figure out how to make it work, right? We know some examples of, you want to park as far away as you can in the parking lot to walk up. Try to avoid using elevators if possible and take the stairs. Those are things that I absolutely advocate for. I think sometimes people think when you tell them they need to exercise, they immediately their mind goes to getting a gym membership. And I'm like, no, no, that's not what I'm talking about.
Right.
People don't have time to go to the gym, or it's expensive and don't want to have to pay the money. Find something in your house, right? When it comes to exercise, you have to think outside the box. I don't have any weights. Do you buy milk? You got a gallon of milk? That's a weight. Okay.
Right.
um do you have a bag in your house? Fill it up with shoes or clothes. That's a weight. And so again, trying to incorporate exercise into your daily life, things that you're already going to do. I oftentimes will wake up when my kids were younger. I can't leave the house again because they're sleeping, but I want to get my exercise in. I just put my Fitbit on and start it, and I just start walking laps around the house. At the end of the day, by any means necessary, whatever you have to do to make it happen, that you make it happen. For people who have not exercised in an extended period of time and are new to exercise or wanting to kind of get back on the saddle, what I would suggest, again, we're going to go back to Google this time. Get online. Type in, like, I'm new. If there is something that's ailing you, let's say, for example, you have a bad knees, right? New exercises for people starting off who have knee problems, and it will pull up a slew of videos of things that you can do and have someone that walking you through exactly how to do them. And that's where I would advise you start.
Thank you. Thank you. All good little tidbits. I know when I first started out, mine was just dancing in the house and exercise. My cleaning was my exercise, taking the basket up and down the stairs. As you said, that was my weight. There's different things. Thank you for those examples.
Yeah.
Um, my next question would be, how important are supplements or vitamins versus medication? And once you do get on medication, what would you say are the best? Because I know I've heard some say you're going to either do it on this end or that end. When a lot of people don't take vitamins or supplements, I don't know if that's important or not. I think it's maybe preference. I don't know. I'm going to ask someone who's in the health industry as yourself.
Mhm.
And how important are the medications if you are diagnosed with high blood pressure?
So one thing that I'm gonna get on the soapbox here for just a second. I think sometimes we think because we need a prescription for medication, it's coded as a medication. And because we can just go into, let's say, a grocery store and pick up a vitamin or a supplement, we don't necessarily look at it the same. It's still a medication. The only difference is one requires a prescription and the other one doesn't. Um, the difference between a medication and, again, a vitamin or a supplement is the vitamins and the supplements usually do not go through any type of testing. Really important. So where a medication has gone through rigorous testing, we know what's in it, we know how people have responded to it. Supplements and the vitamins that you could pick up in the store, no, there's no oversight on what's printed on those labels. Do we know that what they're telling us on this bottle is in this medicine is what's actually in it? We have no idea usually. I think because one is more easily accessible, we don't necessarily view them the same, which we really should. In terms of which route to go, vitamins and supplements versus like actual prescription medication. I think that is a journey that people have to decide what works best for them. I've seen people make lifestyle changes, take garlic. Right, I've heard about garlic working to lower your blood pressure. I've heard about drinking warm lemon water. I've heard apple cider vinegar. And my answer to that is always, if it's working for you, baby, keep doing that. Okay. Now, in terms of the prescription medications, specifically for African American people, there has been research that shows there are some medications that work better. One of those is the diuretic, so hydrochlorothiazide, for example. Usually, when I'm taking care of my African American patients, that's my go to, unless there's a reason why they shouldn't be put on that medication. That's usually the first choice.
Can you say
Uh,
the name of that medicine again? Hydro what?
Hydrochlorothiazide. It's a form of diuretic. It's a weaker diuretic than some of the stronger ones they have out there. That medication, again, based on research, tends to work a little bit better in African Americans. Another medication, ACE inhibitors. Those medications, your lisinoprils, these are the medications that ends with a pril. Um, a lot of African American people are put on those medications. But then again, we go back to the research. Research shows that we're more likely to develop the ACE cough from those medications. We're also more likely to develop a very serious and potentially life threatening disorder called angioedema, where it causes swelling of the lips and tongue, which again could cut off your circulation, your airway. I tend to not place my African American patients on ACE inhibitors. I would go straight to an ARB, which is the sister of the Pril medications. However, it bypasses the cough and it bypasses the angioedema and some of those other issues. When it comes to blood pressure medicine, there's no essentially what we do as providers when we get ready to prescribe a medication, we try to consider the full picture before we make a decision. Now, I'm telling you that because it's important for you to know it's a guess. It's our best guess. Okay. Does that mean that we made the right choice? Sometimes it's the wrong choice. When we talk about advocating for yourself, if something is going on, you don't like the way the medication is making you feel, if you've taken this medication for a month and your blood pressure is not controlled or better, you got to let us know. If you don't talk to your provider and let us know that this isn't working, I'm having side effects or whatever, we don't know. We think everything's fine. There are a slew of medications out there to treat blood pressure. If one of them doesn't work for you, let's switch you over to something else so that we can get the right combination for you. While you're working on some of these other lifestyle things, hopefully we can get you off this medication altogether.
Yes. So thank you for that. So definitely advocating for ourselves. My
Mm-hmm.
other thing would be because I do not have high blood pressure, thank God, at this moment in time, but my brothers have it, my mother had it, my father had it. So am I just destined to have it, or is, I do think about that a lot. Like
Yeah.
different things, diabetes is another one, but that's not the topic for tonight. But I do
Mhm.
think, like, am I destined to have it? I haven't had it at this stage in my life. Preferably, I'll continue on the road that I'm going to making lifestyle changes. But my aunt, who was my mother's sister, she was always healthy, and she ended up in her latter years getting it. I believe when she was diagnosed, she was 60 something.
Okay. Yeah, so the thing is, do genetics play a role? Absolutely. Is it a 100% chance that, if your family has it, that you will? Absolutely not. I definitely believe that you can fight your genes, right? But you have to make a decision that this is a fight that you are going to stand up and put your toes down on the ground and like go for it, with all that you have. Just because your family has the disease does not necessarily mean that you are destined to get it. It's important to remember that you hold the key, right? you can decide that, I hate to say it like this because you don't want to like be crass, but what your family showed you was how to get the disease. So you have to decide how to do something different.
I am the master of my destiny.
Yeah, absolutely.
So, yes, and I appreciate you for giving us all this information tonight. I definitely will be taking it and running with some of the topics that you've shared with us. I hope that you will take time out of your busy schedule to come back and share some more information
Please.
with us. Keisha, do you have anything else to add or ask
I just want to
our
ask
special guest?
if you don't mind remembering to share that article with us so we can
Yes, no, I wrote it down
so
here.
we can share it, as a resource with our listeners. That would be wonderful. And I ditto what Vanessa said about making sure you come back some more because I love the fact that you are a straight shooter. You don't come and you just deal with the the lab work. And so we're just looking forward to you coming back and speaking with us on more topics because that's what we need. We need more people who are coming and speaking to our listeners on their level to make sure that they understand the disease, yes, but also understanding how to go to their appointments and advocate for themselves when
Hmm.
they're at those appointments. And
Yeah.
also understanding that they may be dealing with some providers who don't uh, know the research and who may be a little testy when it comes to discussing the research, but how our listeners will need to still put their feet down and advocate, even when they have some pushback from their providers. So that's why I was
Right.
making sure that we ask for the research because we want to make sure that our listeners are healthy and we want to make sure that their caregivers also know how to advocate for their family members and friends. So, yes, thank you, thank you, thank you, thank you for being here. And listeners, I hope you have enjoyed this actual broadcast the way we have. If you want to continue to have continued broadcasts like this, we say it every time. Please remember to donate to Dear Encourager. You can donate on our website, dearencourager.org. We have the actual PayPal. We have what else? What else?
Your credit card, just any form
Consider
of
donating
donation
what
that
every
you can
month.
get.
That would be great to keep this going. We're looking to start safe spaces for people with chronic illnesses and for those who are caregivers. We're here for you, and just remember that we are broadcasting on Instagram, Spotify, Apple, um,
Facebook,
Facebook,
YouTube.
YouTube. We're here for you in many different ways. And please remember to share with your friends. I've been learning it. People are going, oh, that sounds good. Oh, I need that. So share, share, and share again. Dr. Uh, LaTashia, we just thank you so much. And
Yes, thank
please
you
share
guys for having me.
your podcast
Social
tips,
media.
please, with our listeners. Your turn.
What you say? I'm sorry, I missed the last
Would you
part.
just
Your
share
social
your
media.
social media?
Okay.
It's okay.
So you can find me on Instagram at Dr. Tosh Explains It All. And I think it's the same name across all platforms. Dr. Tosh Explains It All.
Okay, I like that. Once again, we thank you. Please join us again for our next podcast. Bye.
Bye, everyone.
Bye.
Thanks again for tuning in to Dear Encourager. We hope today's episode brought you comfort, strength, and a reminder that you're not alone. Your support helps us grow this space of hope and healing, one listener at a time.